My name is Perla Ayala. I'm a new assistant professor here at California State University, Long Beach in the Department of Biomedical Engineering. My research is in tissue engineering, a relatively new field, biology, engineering, chemistry, and medicine that come together to try to solve a very important challenge, which is tissue regeneration. One big challenge is heart regeneration after a heart attack. With new treatments, there's a lot of patients that can survive the first insult, but over time, this can lead to organ failure, heart failure. The only way for some patients, or the only therapy that they have is organ transplantation, and that's a very difficult thing to achieve at this point. So to develop something that could be a substitute for that will be of great importance. There's different ways to do it. Particularly, we use materials to deliver cells, bioactive molecules, or some other physical chemical signal that can enhance that regeneration process. The people waiting for organ transplants, has increased in the past 20 years. The donors has stayed the same. So the field of tissue engineering aims to develop new tissues to make substitutes for these diseased tissues. So my studies have shown that if we deliver these miniature scaffolds with a drug, we can actually both decrease scar formation and also improve the cardiac function of the heart after the delivery of the growth factor. So for the patient, it means that there's some hope that in the future, after a heart attack, we can deliver an injectable therapy that can maybe salvage some of that function of the heart and not lead to heart failure. We can validate this therapy further. This therapy will salvage the heart in terms of it will decrease the scar formation. It would allow for additional muscle to regrow around the heart, and so ultimately it will decrease the number of heart failure that we see today. My goals here at California State University, Long Beach is to continue the research in developing new therapies for heart regeneration, and also develop tissues that we can then implant for organ transplantations, not only for the heart, but for other tissues such as soft tissue repair, and hopefully also going into the central nervous system repair. The field of tissue engineering has progressed a lot in the past 10 years. We can now develop simple tissues in the lab. We can develop therapies that can be injected that have effect, particularly in animal models at the moment, but we can see this moving towards clinical trials in the near future. It is a very early stage, but we have gathered a lot of knowledge, and I can see how this research can really benefit patients, not only for heart repair, but for lung repair and central nervous system repair injuries as well. This is a very exciting time for tissue regeneration, particularly here at California State University, Long Beach, with our new program in biomedical engineering. We're excited to get the new generation of students that will develop new therapies for patients that need these important tissues and organs.